Hi, good evening everyone. I am Dr. J Lakhani. I am a consultant endocrinologist working at Zydus Hospital in Ahmedabad, and I also visit the Zydus Hospital in Anand. And an endocrinologist is a specialist or a super specialist who deals with diabetes, thyroid, sexual problems in men, and periods and other issues in women. So these are the diseases which we deal with. Now today we are going to discuss a very important topic, and a topic which is not talked about so much in both the social media, nor is it talked about in the doctor's office, unfortunately. And that is the problem of sexual dysfunction in diabetes, or diabetes and your love life. Now, with increasing, it's gone the time that diabetes used to be disease of elderly. Now diabetes is seen in type 2 diabetes, especially seen in even in younger men, and we often see men of age of 28, 29, even before they are married, a lot of them do develop diabetes mellitus. So diabetes mellitus is no longer a disease of older men. It's a disease which can occur in younger men as well. And because it can occur in younger men, the real issue of sexual problem really emerges. But like I said, patients do not often talk about it as freely as they should. Now, if you talk about the statistics and data, let me bore you for a minute about statistics. What studies have shown is that ranging from 50% to almost 70% of men with type 2 diabetes suffer from some form of sexual dysfunction or the other, which is quite significant. You have millions of patients with diabetes, and of that, almost half to 75%, 3/4, suffer from some form of sexual dysfunction. Yet, the reported cases are very, very less. The number of patients who really report this, number of patients who really present with this, number of patients who are really comfortable talking about this is much, much lower. So that is the problem which we really face. Now, what we are going to do is, first we are going to try and understand what are the different types of sexual dysfunction that occurs in diabetic patients. Now, there are predominantly three problems. One is reduced libido, or reduced libido also means reduced sex drive. So some men experience reduced sex drive. The second problem, which is the most common one, is erectile dysfunction. We all know ED, right? Erectile dysfunction, that is inability to obtain or sustain and maintain an erection. The third important one, which is very common and extremely underreported, is premature ejaculation. So these three are the most common sexual problems that most men encounter in diabetes mellitus. Now we'll slowly dissect each of them, and we'll try to tell you why it happens, and we'll also try to tell you the solutions behind it. So let's first talk about the one which is most common, that is erectile dysfunction. Now, erectile function, the erection, depends on two important aspects. One is your brain, right? You're aroused by certain things, right? You're aroused by certain objects. You're sexually aroused. That is one. The second issue is the nerves. So while brain is, in a diabetic patient not really seriously damaged, in some cases it is, because if you have low sugar, you can have some amount of brain damage also. But the nerves which lie in the periphery are the ones which are affected in diabetic patients. The longer you have diabetes, or the longer you have uncontrolled diabetes, the longer these nerves are affected, and the more likely you are to have erectile dysfunction. In fact, like I discussed before, amongst the various sexual problems which diabetes patients often encounter, the problem of erection is the one which is most common. Erectile dysfunction is most common. Also, something which is very important, which I'd like to tell you. If a man with diabetes has erectile dysfunction, he is also very highly likely to have a problem with his heart. So studies have shown that, remember, there's small blood vessels which supply to the penis, and these blood vessels, they are often affected by diabetes mellitus. There are also smaller and larger blood vessels supply your heart. So if you have erectile problem, there's very high likelihood that the overall blood circulation, overall vascular system is affected by diabetes, and it's very common in diabetes patients. There's also very highly likelihood that you are going to have a heart problem as well. So anytime a patient comes to me with diabetes and complains about erectile problem, I always do a thorough cardiac checkup, which includes, of course, doing an ECG, an echocardiography, a TMT. But also, more importantly, it also, we do something which is known as CT calcium score, which is a very important test for a baseline heart assessment. So it's very important to do the test for your heart when you are dealing with erectile dysfunction in diabetes. So that is the first thing. The second important thing I'd like to tell you is that those patients who have erectile problem, they also are likely to have other diabetes related complications. For example, they are likely to have problem with the foot. So often their sensation in the foot is much lower. They are likely to have fluctuations in their blood pressure. So these are very commonly associated with erectile problems. So when you have erectile dysfunction in diabetes, what you have to understand is that it's not isolated. It is often linked with other problems as in diabetes as well. The third point I'd like to make as far as erection is concerned is that there are certain medicines, especially ones given for blood pressure, which often cause erectile dysfunction. So whenever we see patients complaining of new onset of erectile function, the first thing we talk about is that we look at the prescription, and there are certain medicines which are there, which when changed to other medicines can help solve the problem of erectile function. So it's a very simple thing to do. But if you talk to your doctor, only then your doctor would know, right? And your doctor is not often going to have the time to prompt that question in all the patients. So often you need to talk to your doctor about it, right? That's the most important thing. And that's in this entire Instagram live session, if you don't take anything at home, just take this point home. Talk to your doctor about it. If you talk to it, the problem will be solved. If you don't talk about it, if you take it home, it's not really going to work. So that's the key point I'd like to really focus again and again on this. So there are certain medicines, like I said, which when given at the right time, and certain medicines which can be substituted, which can help solve the erectile problem. The fourth and the most important point as far as erectile problem is concerned is that once the damage occurs, it's very difficult to reverse that. So again, young patients who present with diabetes mellitus, this is the important message, so if you are less than, let's say, 35, if you have developed diabetes mellitus, your likelihood of developing an erectile problem in your lifespan is 100%. You are 100% going to develop erectile problem if you don't control your diabetes. This is what the statistics tell you. The problem is high, right? So if you don't control your diabetes, if you're a young patient not controlling your diabetes, you are going to face erectile problem. So this is the key message we tell all our young patients, that whenever you are diagnosed with diabetes mellitus, treat it early and aggressively. And if you treat it early and aggressively, in a lot of these patients, we can in fact reverse type 2 diabetes. And if we do that, then the problem of erectile problem does not occur. Just, a few days back, a patient came to me who was just 32 years old, right? And he had HbA1c of 14. Very poor glycemic control, very poor sugar control. And he's been diabetic since the last 4 or 5 years. He was almost 28 or 27 when he was diagnosed with diabetes. So the point here is that he was diagnosed so young, but he did not realize the importance of that, right? And came to me 4 years late. And then at this point of time, of course we can control his diabetes without a doubt. But at the same time, the problem of his erection is not going to completely go away. It's going to stay. And he's not yet married. That's the strange part. So these are the problems which we have to bear. So young patients with diabetes, if you're not sexually active, right, it's very important that we control your diabetes mellitus very early, very aggressively early on, so that the question of erectile dysfunction does not arise at all. So this is about erectile dysfunction. The second problem, which I would like to discuss, is low sex drive, reduced sex drive. Now, reduction in sex drive is again very personal, right? So some people are more sexually active, some people are less sexually active, So it's a personal thing. It's not necessary that, having a low sex drive is something wrong, or having, overtly aggressive sex drive is also something wrong. It's some people eat more food, some people see more television, some people walk more, some people exercise more. It's like that, right? So ultimately, it's a personal choice. However, having low sex drive is one of the early signs of something known as hypogonadism. Hypogonadism means reduce amount or function of testosterone. Now, testosterone is the male sex hormone, right? So, the men, they form a very important hormone in the body, which is testosterone. So, testosterone levels, when they start dipping, this is when the sex drive starts reducing. So, we often ask patients about the sex drive. And how do you know sex drive? How frequently do they have intercourse with their partner? How frequently do they masturbate? How frequently do they have erotic thoughts? These are all symptoms of sex drive. Some associated clinical symptoms are, reduced shaving frequency, so on and so forth, right? Wrinkling over the skin. These are all signs of reducing testosterone. Now, unlike in men, the testosterone levels do not fall suddenly, right? So in women, the estrogen, the women's hormone, and estrogen suddenly falls when they attain menopause. But in men, it doesn't fall flat suddenly. It falls gradually, right? So in men, the testosterone levels fall very gradually. Men of even 70 or 80 years old may also have a very good testosterone level and may also have a good sex drive. At the same time, there could be 30-year-olds who could have low sex drive and reduced reduced testosterone levels. So the testosterone levels do drop with age, but it's not just the testosterone level, it's also how the testosterone works. And testosterone works through testosterone receptors, androgen receptors. And different people have different levels of these receptors, hence different level of the functioning of the testosterone. So these are the issues as far as the testosterone is concerned. So if men who have, low sex drive, one of the things which we look for in these men are the testosterone level. Now, obese people, right? And this is where it links with diabetes. Obese people tend to have lower testosterone. Now, in some cases, it is actually a lab anomaly because obese men tend to have a reduced level of a sex hormone or a binding globulin, something which binds with the testosterone, that is sex hormone binding globulin, which is lower. And because it's lower, the testosterone levels tend to appear lower. But a lot of these obese men also have truly low testosterone, right? It's not just a lab error. It's actually a lab anomaly. It's a true reduced testosterone level. So obese men, again, you have to really look at the testosterone, and especially if they are complaining of reduced sex drive. So the key point here is that if you experience reduced sex drive, the doctor you need to see is an endocrinologist. Remember this term, endocrinologist is the doctor that you need to see. And an endocrinologist would be able to deal with low sex drive by testing for testosterone, by looking why the testosterone is low and giving an appropriate treatment for the same. And trust me, the right treatment by the right doctor at the right time really changes your life, right? It completely changes you, right? So the testosterone levels, the sex drive improves, the muscle mass increases, the overall well-being literally improves overnight. So it's very important for men who have low sex drive to really report to the doctor. And the last important aspect of sexual problem, in the triad of sexual problem in men I talked about, is something which is called premature ejaculation. Someone really interested, I read this somewhere by an expert in this field. He said, premature ejaculation has increased in our society since the last, let's say a decade or half. Something about premature ejaculation I'll tell you, and again from my experience and again from the experience of a lot of experts. Premature ejaculation or early ejaculation, right, which, is again, like I said, a very common problem in men. Premature ejaculation is mainly dealing with psychological aspect. Premature ejaculation is a sign, it's an early sign of anxiety or an anxious personality. This is an important message. Premature ejaculation is not an organic disease, it is more of a mental disease. It's more of an anxiety related disorder. So whenever a patient, and that's why it becomes very difficult to treat, right? The most difficult disorder is not physical, it is not dental, it is actually mental, right? The problems of the mind are most difficult to tackle. So a premature ejaculation is actually a disease of mind rather than of the real organic of the nerves or any other organs of the body or hormones. Premature ejaculation is more of a problem of mental strength. So hence, what really works in premature ejaculation, what really works is calming down, a calming influence, meditation, exercise. These things really work, right? There are special types of exercises which are known as Kegel's exercises, which strengthen the muscles around the penile organ. So these are the things you should do, if you're suffering from premature ejaculation. And there is something, another type of exercise which is very important is known as sensate focus exercise. And this is for couples to do, right? So if your partner, if your male partner is suffering from premature ejaculation, you should do this type of exercise which is known as sensate focus exercise. And sensate focus exercise was actually, invented by a very, some masters in this field who are known as Master and Johnson. And these were the two, there's a Netflix series on this also. So if you are interested in knowing the science and the history behind this, behind sexology. So Master and Johnson actually came up with sensate focus exercise. And sensate focus exercise is basically, instead of getting involved straight away with, with an intercourse, try spending time with your partner, right? Try talking about things which you like. Maybe it's a nice movie that you saw. Maybe the nice dinner that you had. Maybe, some nice party that you went to, right? So you could talk about things. Then it moves on to, a brief touching, holding your partner's hand, looking into her eyes, a little bit, some kissing, so on and so forth, right? So it gradually builds up. And this, it involves a lot of touching. So when, sensation of touch really helps to calm you down, right? Human beings, we all know when you are hurt as a child, when your mother holds your hand or when your friend holds your hand, right? How calming it is, right? So touch really calms you down. And so if your partner is suffering from premature ejaculation, support him, right? Your touch, your understanding, your concern would really help a long way. Of course, there are medications now which are also helpful in premature ejaculation, and they can be easily prescribed. They're easily available. It can be easily prescribed in cases which are more difficult to treat without sensate focus exercises. But like I said, premature ejaculation is really a problem. And whenever, I have a patient who comes with premature ejaculation, I always discuss about the problems of anxiety. And I believe that anxiety has been increasing in our society by manifold. We have all become, our attention span is reduced by so much, like a lot of you would be watching this Instagram live. And then suddenly you see, let's check out what's there on our television. Or let's check out what's there on Netflix, right? Or let's check my tweet. Let's check my Facebook status, right? WhatsApp status. So, we have so little attention span, right? So that reduced attention span is also, so it goes to your sexual life also, right? So reduced attention span gets spilled over to premature ejaculation. So excuse my pun. So, this is what really happens in patients having premature ejaculation. That reduced attention span, the need for instant gratification, all these things really impact, the sexual life also. Why should sexual life be away from it, right? It affects everybody. It affects a cricketer when he's batting in the field. It affects a driver when he's driving a car. Why it will not affect your sex life, right? It will be naive to think that it will not. It will. So, premature ejaculation is a larger problem, not a minor sexual problem. It actually deals more with personality, with thinking, with minds, and so on. So these are the various issues which are related with sexual problems or love life in diabetes. So how do we deal with that? That's the main question. So like I said, this three-pronged problem. For erectile dysfunction, of course, there are medications available. There are also various devices which are available, which are again can be prescribed to you by a qualified endocrinologist. These medicines do very well, right? And a lot of these patients would have, been prescribed this, and generally they need to be taken before your sexual activity. There are, of course, some people who don't respond to medications, and then there could be other therapies to be considered in these patients. For premature ejaculation, like I discussed, it's important to think of meditation, of changing your lifestyle, reducing anxiety, reducing stress, working with your partner, right? And sensate focus exercises of Master and Johnson. And if everything of these fails, there are medications again available for premature ejaculation. And finally, we talk about reduced sex drive. And those people who have reduced sex drive, it's very important that these men, they consider consulting an endocrinologist. And reduced sex drive, like I said, could be an early sign of reduced testosterone. And this could be easily dealt with by a qualified doctor and then deal with the problems associated with the same. So these are the broad points of view, right? Of course, like I said, it's a big problem, but most importantly, I'll tell you before we break this session, the most important aspect I'd really like to share is that whenever we are dealing with the realm of sexual problems, unfortunately in India we don't talk about sexual problems as much as we should, right? This is my overall philosophy and overall thinking, which I feel as a society something which we are doing wrong, right? We have the second largest population in the world, yet, and where do kids come from, right? I mean, so there are sexual activity going on at every given second in our country, but how much of it is really talked about? We don't talk about it. Men don't like talking about it because they feel that their manhood is reduced, which is completely wrong. A strong man, really deals with his problem, and that's the real manhood, is to deal with your problem and not to hide your problem, right? Manhood does not curtail hiding your problem. It means dealing with it. So if you're facing a sexual problem, deal with it. And how do you deal with it? Consult the right doctor. Secondly, even when we talk about these things, like I said, sexual problem cannot be solved in one day. I cannot give you a magic pill which will solve all your problems. No, it's not going to happen. It is going to take time. It is going to take patience. It is going to take some work. It is going to take changes in lifestyle. It is going to change, curtail changing in attitude towards sexual beings, right? So these are the second important point. And third important point, and I really like to really talk about this. There are various products available in the grey market, like, I'll not name them. There are certain alternative medications available there, which tell you that, which has a tiger's, a nail in it and tiger's tooth in it, and, so on and so forth. And if you have this tiger's testes in it, and, if you have this, you'll become like a tiger, in your bedroom, right? It's not going to happen. What is going to happen is that a lot of these compounds actually have heavy metal. And I remember when I was a resident in medicine, we had a patient where the patient had constant fever, right? And we could not find out. Patient continued to lose weight, and we could not find out the cause. The liver had started to get damaged, and for a long time we could not find what the cause was. We dealt with experts across the country, for this patient, and ultimately we could not find a cause. What really turned out was that this patient was taking some form of some alternative medication for his sexual problem, and then that was the one. Then we got this tested in the lab, turned out to have heavy metals, and his exposure to that, we stopped that exposure, and the patient became better, right? Which is, well, to say that these things really cause a lot of problem, and there are a lot of people who understand. There are a lot of crooks who understand that people don't talk about their sexual problems, so they advertise these products on the internet, they advertise it in newspapers, they advertise it in leaflets, and there are a lot of people who fall prey to all these kinds of products, which can cause a lot of harm. Let me tell you, it can damage your liver, your kidney, your nerves, your pancreas, all these things. So be very careful about these issues, right? So before I end, I again thank you for your listening, for being here, for trying to deal with your problem or trying to help your partner deal with his problem. And like I said, it is very important that these problems are dealt with, these problems are reported to the doctors. So the next time I see you in my OPD, please feel free to talk about your sexual problems, right? We can spend that extra few minutes talking about the sexual problems, and we can deal with it. We can dissect it. We can get some direction out of it, right? So these are some important issues, and you have to talk to your doctor about it. We have if you have any more questions and queries regarding the same, please feel free to connect to us on Instagram Live. On Instagram, we have the Zydus handle for Instagram. You can also follow me on Twitter. I am there on Twitter. You can search for Dr. Om Lakhani on Twitter. Zydus is also available on Twitter, and of course Facebook. It's always there. The Facebook, you can always we constantly post interesting material on Facebook. So you can always go to the website of the Facebook page of Zydus Hospital, or you can go to the Facebook page of Dr. Om Lakhani, and you can have a look at those things which you are posting, interesting videos, interesting content, which is going to make you healthier, right? So these are you can always get in touch with us, and of course as a lot of you would be knowing that Zydus Hospital also offers online teleconsultation, right? And I believe that sexual problem is probably the best problem which can be dealt in a teleconsultation, because it gives that level of anonymity. A lot of people are not comfortable personally talking about it, but they are comfortable talking about it on internet or on a teleconsultation platform, right? So it would be a good idea. Of course, some of the patients would require clinical examination, so you'll have to walk in, but it will break the ice, right? So do talk about your sexual problems to your doctor, and like I said, teleconsultation would be a very good medium for dealing with these issues. Okay, so we'll quickly take some questions. So again, if you are looking for teleconsultation, the numbers are given on the Instagram page of Zydus Hospital. You can have a look at that. You can go to zydushospital.com. So www.zydushospital.com. You go to the website, you can Google it also. The website will be right there. And when you look at it, there is an option for teleconsultation. There's a chat bot. You can chat with it. You can book a teleconsultation, and then you can, of course, deal with these problems there. Okay, there are some questions, and there are some comments also. I'll quickly take them before we end. Okay. Yeah, so I think somebody said there are people who consume aphrodisiacs on a regular basis. It can be dangerous. Absolutely agree. This is what I'm telling you, right? So there are aphrodisiacs which are called to be natural, but they may not be. And natural doesn't necessarily mean that it is safe all the time. So these are sometimes very dangerous and can be a problem, right? Okay, so yeah, so these are some of the comments which we had, and again, I thank you all for being a part of this, and I hope you have a healthy sex life, and of course overall we are having a difficult time right now in the COVID-19 situation. So it would be a good idea if you don't ignore your problems and deal with it, and teleconsultation would be a great medium to deal with your physical and certain mental problems if you are facing that. Thank you and have a great day.